Okay, folks ready? All right, good afternoon. Thank you for attending the City of Toronto's COVID-19 daily media briefing for Tuesday, March 24th, 2020. Before we get started, I want to share with you two advertisements that began playing this morning on local radio. One on the importance of staying home to help stop the spread of COVID-19, and the other by Mayor John Tory about staying home, physical distancing, and reiterating that essential and critical city services continue.
This is an important message from the City of Toronto. Stay home. During the COVID-19 pandemic, social distancing means staying home. Only go out for absolute essential needs, like food and medicine. We can't emphasize the importance of this enough. Stay 6 feet apart to prevent the spread of COVID-19. Avoid contact with others. Essential and critical services are being maintained. Please do your part. Learn more at toronto.ca/COVID-19.
Hi, it's Mayor John Tory. To help stop the spread of COVID-19, we've shut down all non-essential city services. We've done this to protect your health and the health of our staff. Of course, all critical and essential services will continue to operate, including our response to COVID-19, police, fire, paramedics, water, and waste collection. You can help stop COVID-19 by practicing social distancing. So please do. For updates, go to toronto.ca/COVID-19.
So more advertising will be rolling out in the coming days, including digital, social, and print. And all of this is in addition to our continuous social media posts and website updates with important public information about COVID-19. Both of these ads are on the city's website at toronto.ca/COVID-19. Today we are joined by Dr. Eileen de Villa, Toronto's Medical Officer of Health, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Dr. de Villa.
Thank you, Brad, and good afternoon, everyone. So by way of update, as of 1 o'clock this afternoon, there are 280 confirmed cases of COVID-19 in Toronto. Yesterday's declaration of a state of emergency was the first time this has been done in Toronto. It will ensure that the city can continue to respond quickly to this evolving situation. Those who are not practicing social distancing, those who are not keeping 6 feet apart from others, are putting essential workers at risk. Our healthcare workers, our first responders, the people who work to keep our water clean and safe, those who take care of our most vulnerable residents, whether in long-term care homes or in shelters, our transit workers, and all others whose work helps these people to do their jobs. They are also putting our most vulnerable residents at risk. Our parents, our grandparents, people with compromised immune systems, people with chronic conditions. They are also putting our civil liberties in jeopardy. Our freedoms around the measures that we are taking right now depend on people taking public health advice seriously. I encourage you to think about this and to think about your obligations to act collectively and to act now. We are at a pivotal moment right here and right now. To those who have followed our instructions to protect our most vulnerable citizens and prevent further spread by staying home, I say thank you. And I ask you to please continue this very responsible and very caring action of staying home. Every single person in our city plays a crucial role in preventing virus spread. Where we go from here and what happens next depends on you. To those of you who believe that your choice to ignore public health recommendations and advice will not make a difference? This is not accurate, and it is not acceptable. In fact, it is simply irresponsible. The consequences we face are citywide, nationwide, and global. You can impact which direction this goes, but it takes all of us to do the right thing at the right time, and that time is now. What you must do, what I'm asking you to do, is to stay home. History will show that there were people who helped others through their behavior, and others whose actions hurt our city's most vulnerable residents. Which side you'll be on is entirely up to you. It is not too late. We can still collectively make a difference, but it has to be now. The time has come to put the greater good before oneself, and to think long and hard about whether you want to jeopardize the health of others simply because it's inconvenient or too difficult to socially distance, to keep 6 feet apart from other people. I've heard examples of excellent physical distancing or social distancing here in our community. I've heard of grocery stores and pharmacies using masking tape to help customers see and maintain 6 feet of distance at the checkout. We've heard about people dropping off groceries or supplies, either for their customers or for their friends, family, and neighbors, dropping off these supplies at their doorsteps. We've also heard about people really taking seriously the advice of not visiting people outside of your household. For those of you who've done these things, thank you for acting responsibly at this very critical time. You are leading by example and modeling the way for others in our new world where keeping 6 feet away protects our loved ones, our friends, and our city. I'm asking everyone to stay home, to protect yourself, to protect others, and to prevent the spread of COVID-19. I ask this because we know that COVID-19 is spread through close contact with others, and we need to prevent the spread of this virus. Now, staying home can still mean staying active. You can try free live-streamed online fitness classes or apps to guide your in-home workout. If you must go outside to exercise, whether going out for a walk or run, I ask that you keep at least 6 feet distance from others. Remember, having children over for a play date is not social distancing. Playing soccer, basketball, or other team sports with friends is not social distancing. Going out for a group walk or a run, again in a group with friends, not social distancing. We know that COVID-19 spreads through close contact with another person's respiratory droplets when they're infected with COVID-19. This means their cough, their sneeze, or spending time and talking with somebody closer than 6 feet in distance. If we keep 6 feet apart, even if someone is contagious and doesn't know it, then you can significantly reduce your risk of infection. We all want to get back to our regular lives. We all want things to return to normal in our city. The best thing you can do to support this is to stay home now. We will get through this, so please stay home, stay safe, and take care of each other. With that, I will now turn it over to Chief Pegg.
Thank you, Dr. de Villa, and good afternoon. As you know, the City of Toronto is operating under a declared emergency. I want to assure everyone that we are effectively managing this emergency, responding to evolving and changing conditions as they develop, and are ensuring that each of the city divisions, agencies, and partners are in continuous connection and collaboration. Our Emergency Operations Center is fully activated, and we have effective plans in place for sustained operations moving forward. We are in the process of formally integrating the COVID-19 task force directly into the incident management system structure that is operating within the Emergency Operations Center. This will, once again, enhance our ability to respond to the ever-changing situation that the COVID-19 pandemic presents on a daily basis. As the head of Toronto's Office of Emergency Management, I am in direct and regular contact with the Mayor, the City Manager, Emergency Operations Center, and their respective teams, and of course with the Medical Officer of Health. We continue to receive expert, timely advice, guidance, and direction from Dr. de Villa and her team in response to the public health COVID-19 pandemic emergency. The City of Toronto's response to the COVID-19 emergency remains coordinated, balanced, and effective. Our first priority, as always, is to protect the health and safety of our residents and our staff. And as you repeatedly hear me say, we will continue to work non-stop to achieve that goal. Today, I want to provide updates on two specific areas: the actions that the City of Toronto is taking with respect to the enforcement of orders that have been made under the Emergency Management and Civil Protection Act, and ongoing planning with respect to personal protective equipment. Firstly, the City of Toronto is actively engaged in inspecting and taking appropriate enforcement relating to compliance with the provincial orders. The City of Toronto's Municipal Licensing and Standards team is working in direct collaboration with Toronto Public Health and Toronto Police Service. As of 8 o'clock this morning, our team began conducting compliance audits across the city. These audits will be running 7 days per week, both in the day and in the evening, until further notice. Enforcement action will be taken against any non-essential business, as defined by the province, found to be operating in contravention of the orders made under the Emergency Management and Civil Protection Act. Secondly, as you have heard me explain previously, our Emergency Operations Center has been working proactively since the inception of the global COVID-19 issue to ensure the continued supply of personal protective equipment that is required by our workers. A comprehensive system has been put in place within the Emergency Operations Center whereby all aspects of PPE inventory, procurement, distribution, and consumption tracking is being centrally managed. We are working with both the Province of Ontario and the Government of Canada to ensure that the PPE supply chain remains open and to ensure that our personal protective equipment needs continue to be met. The comprehensive coordination of citywide personal protective equipment usage provides us with live-time inventory and consumption rate data such that this important issue continues to be managed as a top priority. Our dedicated personal protective equipment task group works specifically on managing all aspects of personal protective equipment, including opportunities for donation that are received. Should any issues arise, we are able to respond proactively. The essential and critical services that are provided by the City of Toronto continue without interruption. Our police, paramedics, and fire service professionals continue to deliver world-class emergency service. We continue to enjoy clean, safe, and reliable drinking water. Our garbage, organics, and recycling continue to be picked up and disposed of safely. Our shelters and respite sites remain open, and our city's most vulnerable continue to be protected. Our long-term care homes continue to operate. Our roads remain open and safe. Our electricity networks remain reliable and safe. Our public transit continues to operate safely and efficiently throughout the city. Our 311 system continues to ensure that our residents can get in contact with us when they need us. And of course, our amazing public health and healthcare professionals continue to lead from the front lines of this pandemic each day. A number of city staff who are supporting and enabling the uninterrupted delivery of essential services continue to work diligently and effectively across all city divisions and agencies. I would like to again thank each and every person who is working to ensure that essential and critical services continue in Toronto. I encourage everyone to continue to make toronto.ca/COVID-19 their first point of access for credible information about the public health response and city service impacts. Each of us need to do our part to follow the recommendations and direction being provided by our public health professionals. The actions of each and every one of us make a direct difference in the outcome of this pandemic. I want to reassure everyone that we remain committed to leading our city through this pandemic. We are a strong and resilient city, and we will get through the COVID-19 pandemic together. Thank you. We'd be happy to take any questions.
Thank you, Chief. We'll start with questions here at City Hall, and then we have a number of journalists online as well. Go ahead, Matt.
I was actually just wondering if I saw Marianne Bedard there. Could I just ask you a quick question on housing? Sorry, Chief. Just my question is on the second confirmed case in the homeless shelter system. Can you tell us if this was at the, I know the release said that there was no connection between the two, but were they both at the same shelter, or can you expand on that and give us a little more information as to how they were detected, if they made it into the shelter system, and so on?
Well, I'll take my lead from the medical officer of health who doesn't provide details on individuals. What I am able to say is that we've had 2 positive cases at 2 different physical locations and in 2 different types of programs. So one was a respite program and one was a regular shelter program. Both of those people are currently at our isolation site and receiving medically supported care.
And just as a follow-up, have you been able to determine if, or test how many people they may have come into contact with?
We are working with Toronto Public Health as they do their contact investigation. That's what they do, and then we work with the agencies involved to make sure we're connecting with anyone that might be implicated.
Dr. de Villa, there's, I've heard of another case within a nursing home here in the city. Can you tell us anything more on that, and whether there are others that that may be at risk as well, or that may have a confirmed case within them as well?
So we know that we do have community spread, as I've indicated on a number of occasions thus far. So not especially surprised, as unfortunate as it is to have COVID-19 infection within a long-term care setting, simply because we know that the residents in those settings are vulnerable to the negative impacts of COVID-19. I don't have specific details for you at this stage, but we do know that there are a number of situations that are being worked up right now by the team back at Toronto Public Health within long-term care and throughout our community.
Could I just follow up and ask how many cases of community spread that you're now aware of?
So what we're estimating now when we look at our numbers, and of course they're constantly changing, the last I heard from the team was that roughly it was about 10% of cases that we're finding that we are attributing to community spread at this stage of the game.
Thanks.
Okay, we'll move online to Brian from the Toronto Sun.
Good afternoon. I know last week there was some talk about relaxing parking enforcement, but we've been hearing from a lot of readers reporting some pretty ruthless ticketing and towing practices downtown, particularly along the 4 p.m. rush hour routes. One restaurant owner I spoke to had his van towed up from the front of his business yesterday while he was loading up with food donations, forcing him to pay $400 to get it out of inbound. Others are saying that they're getting ticketed or towed while doing mundane things like nipping into the pharmacy. Considering rush hour traffic downtown is practically non-existent, how can the city justify continuing to enforce this? And has there been any discussions to make a change?
Go ahead, Matt.
Sure. So thanks for that question. I don't have the specifics around the examples you've given, but I can say that I can confirm for you that we are live to that issue. Those concerns have been received and have been fed into the Emergency Operations Center. And again, I can confirm that that it's being reviewed. As I've explained, the way that the Emergency Operations Center works is there are key leaders from all of our city divisions and agencies connected through that network. So this is a good example of where a situation or a concern has been expressed. It will go into the Emergency Operations Center, be reviewed, and any recommended or any approved changes will be forthcoming. So I won't speculate as to what the outcome of those discussions will be, but I can say that I can confirm for you that we are aware, it is live in the EOC, and a decision is forthcoming.
All right. Thank you very much.
Okay, Christina from CP24.
Hi, Dr. de Villa. If you could clarify how many of the 280 cases in Toronto include people that are currently hospitalized?
So when I last checked in with the team earlier this afternoon, we had 18 in hospital.
Okay, thank you. This question is for Chief Pegg. There seems to be some confusion based on the mayor's comments yesterday at a tech conference that anonymous cell phone data, which I understand was offered by cell phone companies, is being used to track large groups in the city or where people are congregating when of course they shouldn't be. Can you clarify if that's happening?
Sure, thanks for that question. I'm sure, as you can appreciate, there has been and continues to be a wide variety of suggestions that come in to the city and into our EOC process with respect to opportunities to assist in potentially dealing with this issue. So that's an example of one of the suggestions that's been made. I can confirm for you the City of Toronto is not in possession of any of that data, nor is it being used in the City of Toronto.
I'm just curious, would that be something, I mean, I imagine, of course, there are privacy issues. Would that be helpful if the legalities allowed?
Yeah, I wouldn't speculate at this point. Suffice to say, there are an often daunting number of suggestions that come into the EOC process. And like we've explained before, the way that the EOC structure works is we have the right people around the table to evaluate all of those opportunities and to make the best informed decisions that obviously maintain compliance with the law, make sure that we're on safe and appropriate ground, but also that we're only making decisions that will make a positive impact in the COVID-19 pandemic. So I couldn't comment specifically as to whether or not it would be appropriate or not, other than to say that I am aware of that particular case, and I said, as I can confirm, it's not something that the City of Toronto is using.
So if I can pick up from there though, Christina, because you asked what might be helpful. What would be helpful is for people to stay home and to not congregate, right? That's really what would be helpful. I can't emphasize that enough. The most helpful thing that people can do is to stay home.
Thank you. Thanks.
Okay, we'll go back online to Denise from Reuters. Hi, Denise, you there?
Yes, hello.
She's super fake.
Okay, Donovan Vincent from the Toronto Star.
I'm here. Can you hear me, Brad?
Yeah, go ahead, Donovan. Thank you.
I have two quick questions. One for Marianne.
Okay.
The 9 new shelters, the isolation center, the recovery center, and all those initiatives announced in that release, is there a cost figure for that announcement? And also, where is the money coming from? And then I also have a question about sistering. Maybe I can do that as a follow-up, or I don't know.
Sure. So, of course, there is going to be a cost to all of these things. We are moving forward, having those conversations with our provincial and federal partners to determine how that will be paid, but certainly not letting that stop us put in place the measures that we need to protect people's health and safety.
So you said determine how it will be paid, but is there a dollar figure?
We are carefully tracking those things, and I can't tell you today how much it's cost so far. We've made significant increases to service, so I imagine there will be a significant cost to the response.
Okay, and then the other question is regarding sistering. We got a note, saw a posting that they have the drop-in has closed, and there was a temporary shelter that's been moved to another location. Is this the first? How many shelters have been closed, and what's happening in the shelter system overall in terms of closures and?
Well, thank you, Donovan. I appreciate that question. It gives me an opportunity to clarify. Sistering has not closed. They wanted the opportunity to create enough social distancing for the clients that they had in their program. Sistering offers a very unique program in the city, and they wanted to be able to continue to do that for the clients that they had staying with them. So we've provided them with the opportunity to move to a community center so that they have adequate space to continue to offer their program. So it definitely has not closed. And we have not had a single shelter close. They are all open. We are incredibly grateful to our community partners because they run the majority of the sector. And we're just their partners. So it's a huge relief to us that they're still in a position to do that.
Okay, thank you, Donovan. Go to Mike Walker from CTV News.
Starting on the homeless front with the 2 cases that we now have, are there concerns because this population may be one that may be difficult to control with social distancing and all that? Are there concerns about this leading to an outbreak in our system, and what measures are we taking to prevent that?
So, I mean, I've talked about this before. We've developed a very comprehensive 3-tiered approach. We're focusing on prevention, mitigation, and then recovery. We've rapidly implemented this plan over the last week. And, you know, we are taking significant steps because we do know that this is a very vulnerable population. Many people have underlying health issues. So we want to make sure that our actions are significant and address the issues that are happening. We're having regular communication webinars with all of our community agencies. Gives us an opportunity to share information and advice with them, and them also to share best practices with one another. We are providing information, support, communication tools on how to create social or physical distancing within shelter systems, things like doing different shifts for meals, scheduling the use of recreation facilities and time. So there's lots of creative things going on across the shelter system. And again, I'd like to thank our community partners for being in it with us.
And just following up on that note, I know in the release today it talked about another facility potentially opening. Do we know where and when and how many more spaces that could be?
So we opened another facility yesterday at a community center. We opened another one today. In total, in 7 days, we've opened 9 facilities. So again, a significant response. We've got an isolation site for people undergoing testing. We have a COVID recovery site that will likely be opening on Thursday. And so, you know, we continue to be nimble in our response. It's a rapidly evolving situation. Everybody says that, but it really, really is, especially with this population. So we continue to work really closely with our partners in public health and at the EOC and with our community providers, and we just adjust as we need to.
And on the TCHC announcement today, I'm not sure if you can speak to this. We spoke to some tenants who are concerned with April 1st right around the corner that maybe these measures announced today may not take effect right away.
No, TCHC is committed to working with us. Maintaining tenancies is one of the most important things that Shelter Support and Housing and the City of Toronto is working on. So they are absolutely open to having those conversations with tenants who have had a change in their income and are going to have difficulty paying rent on April the 1st. If you're in a rent geared to income unit, we're also looking at readjusting your payment in recognition of what your new salary is. So every effort is being made both with Toronto Community Housing, but also our 200 other social housing providers who do similar work.
Thank you.
Okay, Denise from Reuters, we'll try again. Go ahead.
Hi, is that better? Hello?
Denise, are you there?
Super faint,
Yes.
super
Can you hear
faint. She's there, but it's really, really low.
Okay, well,
Yes.
oh, there you go.
Can you hear me?
Go ahead. Sorry, Denise.
Okay, perfect.
Thank you.
Just a question for Chief Peg. You mentioned that you have a system for PPEs. Is this just for Toronto? And can you say how many we have in the city? And in terms of, for example, for ventilators, how many do we have as well?
Hi, thank you. So yes, we have a very comprehensive PPE or personal protective equipment management program that is operating within the structure of our emergency operations center. There's actually a dedicated task group that operates within the incident management system in the EOC, looking specifically and on a full-time basis managing PPE. We are, the focus, of course, of the City of Toronto's Emergency Operations Center is limited to operations within the City of Toronto, although I will say that we have centralized all of the personal protective equipment issue across the entire City of Toronto, including not only city divisions but also agencies. We are in direct connection and collaboration with the Province of Ontario and the Government of Canada with respect to making sure that our supply chain remains open and that our needs continue to be fulfilled. I don't have specific numbers for you with respect to what we have, but I will say that at present our inventory is stable. All of our frontline workers who rely on PPE are being provided with that PPE, and as a result, our frontline essential and critical services continue to operate without amendment.
Okay, so you're saying that there's no shortage at the moment?
That's correct. At the moment, our inventory is stable. Our consumption rate is relatively normal and is being tracked, literally being tracked live time. So as I explained before, the reason that we're monitoring this as actively as we are, we will be able to identify in the event that we start to experience some type of inventory issues or our consumption rates climb and are outpacing the inventory, if you will, we'll be in a position to react to that expeditiously and in the appropriate manner. But at present, everything is stable. Our workers have the PPE that they need, and our frontline services are continuing as mandated.
Okay, Jeff Gray from the Globe and Mail. Jeff?
Hi, folks. Can you hear me?
Yes, we can. Go ahead, Jeff.
Great. Yeah, I just want to ask about the spaces that have been created in the shelter system. The number I saw in the release was 340, 9 new shelters. Can you just address the question of, I mean, there's 6,900 spaces in the system, right? Something like that. How does 340 added into it create enough space for social distancing? These are generally quite crowded facilities. So if you could just expand upon how is it that the shelters continue to operate and everyone is able to stay 6 feet from each other like the rest of us?
So again, thank you for that question. We've been focusing our new spaces on the 24-hour respite program. The 24-hour respite standards require less than 6 feet between sleeping, but shelters, the shelter standard is 6 feet already. So within shelters, although we are trying to reduce the capacity in those programs, there are already opportunities in place to create the social distancing that is required. So we're focusing on the programs that we have the most risk, and we are making sure that they have that same opportunity to create that distance. As we continue to evolve our response, we'll be looking more carefully at some of the other programs that may need some relief.
You have a follow-up, Jeff?
As a follow-up, just am I correct that the city has paused or stopped tearing up, or no, not tearing, whatever, stopping dismantling encampments? They find homeless people camping somewhere, maybe seeking to escape the shelter system. Am I right that we're not doing that right now? We're not taking those encampments apart?
So our street outreach continues. We're continuing to connect with people. Our Streets to Homes model is to move people directly from the street into housing. So that continues. So that work is very, very important. The other thing that we continue to do with our partners in transportation is to monitor those sites for health and safety. So although we're not clearing those sites, we are giving people the opportunity to stay where they are. We do continue to monitor that those sites remain safe for the occupants there and for the nearby community.
Thank you. Jennifer Pagliaro from the Toronto Star. Go ahead, Jen. Jen, you there? Okay, we'll come back to you. Lorenda Redekop from the CBC. Go ahead, Lorenda. No? Okay. Well, let's try in here. I know Matt Bingley can speak. Go ahead, Matt.
Chief Peg, I just have a question for you. I have a source that is telling us that firefighters have been ordered when not going out on medical calls not to wear a protective mask. I'm just wondering if this is the case and why that decision was made, and if so, when you might actually consider following suit with other cities who have decided to no longer have firefighters go out on medical calls.
Sure. So thanks for that. So at present, as recently as a conversation I had this morning, I can tell you that there has not been any amendment with respect to the tiered response protocol that exists in the City of Toronto. So our firefighters continue to be engaged in medical response and continue to be provided with the same levels of personal protective equipment that have happened, I would say, normally and in the past. Important to note, though, that the decisions around tiered response, so the decisions that inform paramedic response and inform fire service response, come from a group of medical doctors that provide that expertise and direction to us by way of protocol. So if the point in time comes where there is expert medical direction that is provided to us that suggests that tiered response criteria needs to be adjusted, that's absolutely something that would be looked at and considered. Likewise, if the point in time comes when there are external factors that might warrant those decisions, such as personal changes in availability of PPE, we would look to the same group of medical experts to provide us with that direction. But at present, everything is normal, everything is stable, and I'm not aware of any changes that have been made to protocol.
Okay, sorry, you used a fair bit of jargon there. I just want you to sort of dumb it down for us. So are firefighters, when they respond to medical calls, in fact wearing the same masks that a paramedic would?
Yes. So there's been no change to the provision of personal protective equipment for our responding firefighters. I apologize for the jargon. Protocols are a series of specific medical directions that are provided by doctors. They inform, obviously they are the experts in the field. They provide those instructions to us with respect to the levels of personal protective equipment that our firefighters wear, as well as all of the disciplines and all of the services, if you will, that are provided. So there have been no changes. That is constantly being monitored. Again, it's being looked at from a PPE availability standpoint. It's being looked at medically. And the only time that there would be a change is if there was a medically necessary circumstance that warranted that change. At present, that has not happened.
Thank you.
You're welcome.
Okay, we'll go back online. We'll try Lorenda Redekop again from the CBC. Lorenda, are you there? No. Okay, so like the before times, technology still fails us when it's needed most. Let's Mark Douglas from 680 News. Mark, we'll try you, please.
Thanks. You guys can hear me all right over there?
Yes, Mark, go ahead. Thank you.
Chief Peg, can you fill out some details on what these compliance audits look like that began this morning? How exactly do they work? What are you doing door to door? And what you mentioned that enforcement is being taken. So what does that enforcement look like? Is that going to be, are you putting padlocks on doors? Are you laying down fines of these $25,000 per day fines? What sort of details can you share with us on that?
Sure. Thanks, Mark. So the compliance audits, as I explained, are being done by members of our Municipal Licensing and Standards Division, our bylaw enforcement officers who are active across the City of Toronto and who are proactively monitoring non-essential business areas with respect to complying with the order. So when they are out and about and in the course of their audit duties, in the event that they encounter circumstances where a business that has deemed to be non-essential by the province, if they encounter a circumstance where they are not complying with the order, there will be enforcement action taken. The Chief Justice of the Province of Ontario has established a number of set fines, so in essence, in layman's terms, tickets that are able to be issued. And like we explained previously, the violations now range from tickets in the range, Chief Saunders explained in his press conference today, between $750 and $1,000, all the way up to hundreds of thousands of dollars, depending on the nature of the offense and how the enforcement action proceeds. So our audit team will continue. They will take the enforcement action that is appropriate and reasonable in the circumstances. And of course, that, as we can all appreciate, is always situationally dependent and always dependent based on the circumstances they find.
Thank you, and there we go. And a follow-up then for Dr. de Villa. Between the beginning of these compliance audits and the enforcement and the fines that are being handed out now, and Dr. de Villa, I'm hearing very much stronger language from you today in your plea to get everybody to just do social distancing. Between the audit and your wording today, would you say that we have arrived at the tipping point in containing the spread of coronavirus?
Well, I think what you're hearing from me is, the urging and my continued urging for the public to engage in social or physical distancing, keeping 6 feet apart. This is a very, very important component to our response as a city to COVID-19. I think that there isn't a particular point per se or, a magic, destination other than to say that the more we are able to do, the more we are able to keep our distance, the more we are able to support social distancing throughout our city. It helps us in public health respond more effectively. It helps those of us who are continuing to work to help our city keep running, to run safely and smoothly. And the sooner we will be able to return back to, a semblance of what we have been used to in the past, our regular lives. So I just can't emphasize enough how important it is for people to really get behind social distancing, physical distancing, keeping 6 feet apart, staying home.
And Dr. de Villa, just one last quick follow-up on if I may, on the specific numbers that you've been asked about before. We have 18 in hospital, 10% spread, the community spread. How many recovered cases have we seen in Toronto so far?
So at last count, I believe we were at about 4, if I remember correctly. I'll have to check. These are numbers that are constantly changing, and I admit it's difficult to keep track of all the numbers. I think that being said, as we go with our case and contact investigation and as we focus on public health measures and making sure that we're activating our full response with respect to COVID-19, there is less and less emphasis in respect of trying to keep track of the numbers that are recovered. However, I've just got a signal. I think I underestimated the number recovered. It's 5. So I was off by 1.
Okay, thank you. Okay, Loretta Redikoff from CBC. Let's try one more time, please. All right, not your lucky day, Loretta. We'll get this sorted out. I apologize. Richard Warnica from the National Post.
Hi, Dr. de Villa. Can you hear me?
Yes, go ahead, Richard.
I was speaking to an ER doc in the GTA who told me that she and some of her colleagues are concerned that there is a lag time between positive tests coming in and patients being informed. In some cases, they're talking about up to 5 days between a positive test coming in and a patient being informed. And she and her colleagues were really concerned about this. Do you have any idea of how widespread this is, or of what the average lag time between a positive test coming in and patients being informed is?
So with respect to testing, we know that positive tests and following up on positive tests is a key priority. So I actually had not heard about significant lag times in those tests being reported. I had heard some lag times with respect to negative tests being reported, and I'm sure you can appreciate why that would be less of a priority relative to following up on positive tests. Clearly, we want to follow up with positive tests so that we can do our full case and contact investigation and limit the spread of disease from that perspective. But I'm happy to follow up further, and I'd be interested to hear what other emergency room physicians and other primary care providers are seeing out in the community.
So just so I'm 100% clear, you hadn't heard up until now that there is any significant lag between positive tests coming in and patients being informed?
To my knowledge, we have done, taken every step possible to ensure that positive tests are followed up very, very quickly. And I'm sure you can appreciate that case and contact investigation is one of the key aspects of the public health response.
Okay, thanks very much.
Okay, Lorenda, we're going to try this one more time, okay? And if not, we will get you your answer via email, I promise. Go ahead. Lorenda? Okay. Apologize, Lorenda. We'll get you an answer. Thank you, everybody, for coming, and we'll sort this some of these audio issues out tomorrow. Thank you.
Asking me for my check. She said.